Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Sarah Anderson. In this episode, we discuss new COVID-19 vaccines and how they may affect risk stratification. Joining us are Dr. Fernando Carnavali, Division Chief of General Internal Medicine at Mount Sinai Health, Dr. Renslow Sherer, Professor of Medicine in the Section of Infectious Diseases and Global Health at the University of Chicago, and Dr. Joseph Torrisi, Clinical Pharmacy Specialist in Infectious Diseases at Grady Health System. For more information about Dr. Carnavali, Dr. Sherer, and Dr. Torrisi, and for a link to the full online educational program, including downloadable slides, please visit the links in the show notes for this episode. Now, let's get started and hear what Dr. Carnavali, Dr. Sherer, and Dr. Torrisi have to say about new COVID-19 vaccines.
New vaccines, such as the Omicron-specific vaccines, affect risk stratification. Do you think that new vaccines will affect our risk stratification?
I think that in a way they will. I think that with some of the information that we have, and I think that we're going to see all throughout the presentation, we don't have enough data yet, but I think that stratification may change.
Yeah, it's pretty important to say that we know when it comes to scarcity and the distribution of treatments, then vaccine access, certainly in Tier 1 and Tier 2, the NIH identifies who should we prioritize first if we only have so many monoclonal antibodies or antivirals available in our institution. And so the unvaccinated clearly are at highest risk of the most severe disease. So vaccination is part of the risk stratification. It's not the end of it. And I think there's a sense among our peers, our colleagues in the health professions and in the general population that if you're vaccinated, you're sort of done. You don't have to think about SARS-CoV-2 anymore. And I think that's a barrier because of this continuing mortality that we're seeing. It's going to be something over 200,000 total Americans dying this year. And many among them will have breakthrough infections. So in spite of the good news about our vaccines, we still will need risk stratification and need to understand who's most vulnerable, even with breakthrough vaccination.
Yeah, and I think that we're going to talk a tiny bit later, but we see that with long COVID too. On people that have been vaccinated many times and continue to develop disease. So,
as part of the NIH risk stratification table, vaccines are probably always going to be in your top two. Those who are unvaccinated are always going to be those at highest risk. And I agree, it's not the end of the road without vaccination, because those who are, think of our transplant patients who don't respond well to vaccines. So I think even if you have an Omicron-specific vaccine, that's still not going to affect their immunocompetency at that point, and they still may not have an adequate response to those vaccines. So I think at that point, those patients, even though they're vaccinated, still need to practice masking and avoiding crowded areas, probably to the best of their ability to fully mitigate the risk as best as possible. So I agree. I think vaccines will play a role with, Omicron-specific vaccines, but I don't know that, as you said, that's the end of the road just based on, patients' immunosuppression.
Yeah. And, we see this long list of this qualifies for being at greater risk for SARS-CoV-2. Within each one of those groupings, there's actually varying degrees of risk. So cancer is a risk, but more distant cancer is less of a risk than a recent diagnosis on active chemotherapy. And hematologic malignancies more so than some others. Or among folks with HIV, I'm an HIV clinician. We know that untreated or advanced HIV is a good way to frame it, that is the greatest risk. And yet, if you look at the South African series or the recent WHO series, there was a twofold increased risk across the board. And that included people who were with higher CD4 cells who were better controlled. So I think that means that we probably do need to consider both risk stratification and think about the vaccine status.
Thank you very much to Dr. Carnavali, Dr. Sherer, and Dr. Torrisi, and thank you to our listeners for joining in. As a reminder, to view the full Clinical Care Options program on expert insights into optimal outpatient management of acute and long COVID-19, click on the link in the show notes for this episode. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.